Hello everyone. Welcome to your lecture on prenatal nutrition. So nutritional needs in pregnancy are very unique. We want to make sure that pregnant women get all the essential nutrients that she needs to help her body as well as her fetus's body grow. So healthy eating enables optimal gestational weight gain and reduces complications. Maternal nutrition does have a direct effect on the fetal well-being and the birth outcomes. Vitamin and mineral supplementation are recommended during pregnancy due to the increased need for nutrients. Little evidence, with the exception of folic acid, supports giving vitamin supplements to healthy pregnant women. However, we do tend to recommend women take a prenatal vitamin in pregnancy. Iron and folic acid need to be supplemented. Because if it's not, it can lead to complications or could be implications for the fetus. So folic acid is essential prior to pregnancy in all childbearing women and in early pregnancy to prevent neural tube defects, which is the same as spina bifida. 400 to 800 micrograms are recommended for most pregnant women. So we need to make sure before they get pregnant, or any pregnant woman of childbearing age, whether or not they're planning a pregnancy or not, should be taking folic acid supplements. And the reason being for this is that a lot of pregnancies we know are unintended pregnancies. Ferrous iron of 27 milligrams is recommended due to increase of iron deficiency anemia. And this can lead to low birth weight fetus and also can affect the fetus's IQ and can lead to mental retardation if the fetus is deprived of iron. Women with a history of having a previous child with a neural tube defect or who take anti-seizure medications often require more folic acid. So this is going to be 4 milligrams. Okay, so that's going to be a lot more than the basic standard dose recommendation of the 400 to 800 micrograms. Just because they're more prone to having a child with neural tube defect. So guidelines for healthy eating. So as a rule of thumb, women should fill half of their plate with fruits and vegetables. Choose unsaturated fats as opposed to saturated fats. And really some good sources of fat include things like peanut butter, avocado, almond butter. All those kind of nut butters are really healthy sources of fat. They should eat breakfast every day. They shouldn't really skip any meals. Choose whole grains instead of refined grains. We know refined grains, things like white bread, white rice, white potatoes, all those kind of things are more simple sugars, and they should be avoiding simple sugars and filling up on whole grains. And iron-rich whole grains are good, but also foods that are really high in fiber intake, because that helps kind of with constipation as well. So not only are they getting a nutritious diet, they're getting plenty of fiber. And then avoid hydrogenated or partially hydrogenated fats. And that's kind of the stuff that you find in all these junk foods like donuts, cakes, cookies, pies. And not only that, it does put on unwanted pounds in pregnant women. So that's usually the first thing that I would ask a pregnant woman if she has like excessive weight gain. So let's say she came back 4 weeks later, after her initial visit, and she put on 10 pounds. That's a lot of weight gain. So we need to talk to them about why they put on all this weight and what they're eating. And usually the first thing I would tell them is to cut out the junk food in their diet. It's okay to once in a while have a sweet, but they shouldn't really make a habit of it because it just doesn't have nutritional value and it's not good for them. It puts on unwanted pounds. So eat at least 2 servings of fish per week, with one being an oily fish. So again, salmon is a really good choice if they want fish. Avoid high mercury fish. So those are going to be things like swordfish, shark, mackerel, orange roughy. Those are all really high in mercury, and so that can be dangerous for the growing fetus. Consume at least 3 quarts of water a day, and they should just be making a habit of drinking mostly water. but they should keep themselves hydrated, especially in the summer months when it's really hot. And if they're exercising, they really, really need to stay hydrated.
I didn't get that. Could you try again?
Okay, so special diets in pregnancy. So unless they're gluten intolerant, pregnant women should avoid gluten-free diet due to increase in fat content. So a lot of times with these gluten-free diets are replacing a lot of the nutrients with fat. And that again is going to put more weight on these patients. But if they truly are gluten intolerant or they have celiac disease, something like that, they need to go ahead and continue to follow that diet. And there is less nutrients, vitamins, and minerals in those in gluten-free foods. Avoid high mercury fish. So I just mentioned that in the previous slide, and those are some examples. And then salmon, shrimp, canned light tuna. They can have up to 12 ounces per week is safe, but they don't want to overdo it on the tuna because it does have some mercury in it. Avoid unpasteurized milk or milk products, soft cheeses, deli meats, deli prepared salads, and cook all meats to 165 degrees. And the reason being is because of the risk of listeriosis. This is a very dangerous bacteria that if it's transmitted to the fetus, which it is vertically transmitted in utero, can actually lead to stillbirth.